Good evening. This is Donna Hazelwood. I'm making a project presentation to review the past week's presentation that we made for our class. I am doing a project presentation on heart health, what you need to know. I'll begin by creating an outline for my project presentation on the presentation dynamics of the program with regard to planning, development, implementation, outcome, and then what the evaluation of my goals were for this project. I'll start off with planning, and in this class there was what brought me about to this part of the class was the completion of a community assessment in a previous module. And from that community assessment, I identified a health concern in my community, which was cardiac disease that began at the age group of 44 years old to 85 plus. From there, I began to gather information that was related to cardiac disease that had to do with the important facts, which the important facts were that it is the number one reason for the death in this community. Uh, Actually, it's the number one cause of death in the United States and in Arizona, and which is very alarming. Some of the information that I discovered was that it has decreased. The number of deaths have decreased since 1999. However, it's still considered a number one cause of death, and that there are more men that die from cardiac disease as opposed to women. I also identified risk factors in that most of the risk factors involved with heart disease are modifiable, such as lack of exercise, stress, being overweight, diabetes, smoking, and having high cholesterol. They're all considered risk factors. And other items that are not modifiable, such as age, gender, or sex, um, or are, they're it's just something that you have to live with, unfortunately. But keeping track of the modifiable risk factors can reduce your incidence of having that occur. Other items that I started to begin to look at were at heart health, which were had to do with nutrition, and I highlighted a program called DASH, which is Diet Approaches to Stop Hypertension, which outlines food groups and daily servings that you need to have of the different food groups, such as fruits and vegetables and low-fat or fat-free dairy products, nuts and seeds and fats and oils, and just trying to reduce the amount of sweets that are eaten. And I included a website from the American Heart Association on healthy recipes that can be cooked from just about any category of food choice that you might have. Also, I included some information on um, the amount of exercise that you would need to get each week, and that establishing goals, short-term goals for at least 5 times a week, such as walking or doing housework or something like that, were beneficial, and that just trying to reduce stress, that's really important. Other things that I included were episode or ideas on quitting smoking, and tips on quitting smoking, and that alcohol can be consumed, but it needs to be done in moderation. Women 1 drink, men 2 drinks a day. Um, Also included information on resources such as your primary care provider, also the local hospital, Northern Arizona Healthcare, community resources of where someone can go to check their blood pressure, such as the fire department, the drugstore, or Walmart, and then websites on the computer that people can go and look at, which was NIH Health, website, the American Heart Association, which offered a toolkit for blood pressure and how to manage hypertension. Um, and that, I offered some facts about heart disease and hypertension. And it was interesting because 75 million people have hypertension. And of that three, only 1 in 3 have prehypertension, with half that number that don't even have it under control, which is alarming because that's a lot of people that's walking around with potential for heart disease. There is, the risk of hypertension dramatically increases the risk of cardiac disease, as well as diabetes and stroke. And in 2014, there were 410 deaths associated with cardiac disease, which amounted to over 1,000 people a day. And there were associated healthcare costs that went along with that almost totaled $50 billion. And again, the habits that go along with it are modifiable and can dramatically reduce the incidence of this occurring. Also, cholesterol, and I included information about that and how you need to try to keep your cholesterol in good numbers, and it is naturally produced by your body 75% of the time, with 25% obtained from food choices. And it's kind of interesting. The men experience high cholesterol levels higher than women. However, when a woman reaches the age of 55, there's a higher incidence of this occurring, as it's thought to be related to menopause, and that the HDL, which is good cholesterol, needs to be kept high, and it's harder for a woman to maintain that. And then just healthy food choices are important with that. And then I gave an example on how to take your blood pressure, and included medications that were commonly prescribed for blood pressure, and what some of the side effects are, and what you need to do to manage your blood pressure, and what some of the symptoms are that you have, um, as well as diabetes and cardiac disease going together, and some of the different lab tests that are due, that you can have done that can help you determine if you have diabetes and how it's related to cardiac disease. And again, with diabetes, you're at increased risk. Once I uh, researched and gathered all this information on cardiac disease, I visited the local library and established that as my location for my presentation, and determined the type of presentation for my target audience would be in the form of a PowerPoint presentation and an infographic that was in an easy to understand format. Once I did all that, then I went to the development phase of my project and just started doing research again, continued research on cardiac disease, received the statistics from the information from Yavapai County, did the research on the heart healthy topics, met with the library staff, and gave them a flyer on a presentation topic, which was heart health, what you need to know, determined the date, the time, and the place, and developed the teaching materials related to the presentation for my target audience, which was kind of difficult to come up with because it was the community, so I didn't know what the potential for the age categories would be. And then I continued work on the PowerPoint presentation and the infographic on cardiac health. When the time came for the presentation, it was implemented on the 13th of April from 2 to 3 p.m. at the Camp Verde Public Library in the Key Lime Room. A PowerPoint presentation was prepared and readied. An infographic handout was prepared and readied. Once I arrived at the library, I had the staff, they helped me set up the audiovisual and made copies for me for the infographic. Unfortunately for my presentation, no one showed up, so I wasn't able to effectively give out my presentation. However, the outcome of the presentation was I did a thorough PowerPoint presentation that outlined the benefits of heart health, such as nutrition, highlighting the DASH diet, diet and the importance of exercise and stress reduction. And I included tips on maintaining habits in moderation, such as with alcohol, and the importance of quitting smoking. The information was provided on hypertension and diabetes as well, how to take a blood pressure, check a blood glucose, and knowing important labs such as cholesterol and hemoglobin A1C, and the tips on blood pressure medications, and the infographic that I prepared to be given out as a handout, as well as providing in my PowerPoint the available resources that were ready. When evaluating my project overall, after it was all said and done, although no one showed up for the presentation, it did make an impact on me, on this writer, and making changes with nutrition and salt intake, as well as knowing what my blood pressure is and lab values that are important with heart health. Also, my husband viewed my presentation and commented the information was easy to follow and understand. Overall, it was a very helpful assignment that did make an impact on myself and my family. The resources that I used for this presentation were images.com. Thank you very much for the opportunity, and it was a very good lesson and assignment that accumulated over the course of the last 7 weeks. Thank you very much, and good night.